Good morning, everybody. Today we have assembled to commemorate the World Mental Health Day, which actually falls on 10th October every year. As we all know, emotion is one of the most important aspects of human life, and the custodian of this balanced emotion is done by the people who take care of the mental health of the population in this country. So, in this regard, I would like to introduce one of the most important key opinion leaders of mental health, Dr. Jagadish.
Thank you, sir.
Dr. A. Jagadish is a NIMHANS trained MD psychiatrist. He was also a pioneer in establishing the Kempegowda Institute of Medical Science Department of Psychiatry. Currently, he is now the director of Abhaya Hospital, which is one of the major nerve centers for managing psychiatry de-addiction in the city. So, more than me talking, I think I should hand over the session to Dr. Jagadish, our expert today. So, my first question to you, Doctor, is what are the myths and misconceptions of mental health, and what are the stigma that are related to mental health?
Myths about mental illness persist across the society, all classes of people. More so among the rural and lower economic status community, because they have less access to knowledge or not knowing where to know about the mental health. Compared to last 2-3 decades, the awareness has improved. Still, the myth about mental illness persists because of lack of awareness among the society. Probably if we include this among the curriculum in children, as they grow older, they will also be as sophisticated as their peers from the West to understand the mental health. What is anxiety? When I should consult a mental health professional? Need not be a psychiatrist, a mental health professional. When to seek help? Why I should not suffer? What are the impact of this thing? In this country, whenever there is a psychological breakdown, there is a set of people who think probably getting into some rituals, visiting the temple or their spiritual guru may heal, not understanding that this also has a component of medication with other therapies are required. So when they go through all those things, some minor psychological illnesses like anxiety, some sort of a distress, panic related to stress, etc., may get absorbed. But major mental illness, when everything fails and it becomes unmanageable, they reach the doctors. And usually when we give a proper explanation why a mental illness can happen, the acceptance is better today. And still, why a patient can have mental illness, that myth persists. Even among the educated, I didn't have any stress, doctor. There was no crisis. Still, my child has a mental illness, or my son, daughter has, or myself has. So they're still not able to understand what are the causes for psychological disorder. So this persists in society, but definitely it is better. Coming to stigma among mental illness, mental health is there across the globe. Only the level varies. It depends on 2-3 things. One, accessibility to mental health and confidentiality and privacy can help many people to seek help. That is one of the things. The stigma can be from 3 angles. One, from the public, how the society looks into people with mental illness, especially more so among the patients who have this major mental illness like schizophrenia. Sometimes they had an episode of mania. All this because their behavior becomes so obvious. If they are not taken for consultation and treatment at the earliest, the society comes to know about the abnormal behavior of the individual. That is the biggest stigma of the public viewing a mental illness. Second, the individual and the family. Especially, I'm a little distressed to tell that lot of children and adolescents who form the base of this country are going through a rapid change in the social norms, having access to media, access to social media, I mean, distraction, and parental attention has come down because they have to struggle to meet 2 meals a day and the end and all. I'm not talking about rich alone, I'm talking about all class of people. In this, when the child goes through this trauma, lot of parents are hesitant to bring them to a psychiatrist, thinking that there is a stigma attached. My child has. It can happen to any child. So the stigma is not about one area, it is about among all. Second is about the individual. When they go through in the initial phase of illness, when they can understand something is going wrong, but I know that I am unable to manage, they have a stigma. Should I see a psychiatrist? If I go to a psychiatrist, what will happen? And more so among the people who are working in the corporate sector and IT sector, because they have a fear, if it is noted or documented, it can come in the profession, my way of my profession, promotion, etc. So they are very vulnerable. They say, doctor, can you treat me without documentation? So that is. Third thing is, whenever a patient, especially major mental illness, schizophrenia, bipolar disorders, etc., when they start improving in the initial phase, a gentleman aged 22 years, around age of 22, had a psychological breakdown, has sought help, recovering, they will have a highest stigma. Oh God, this is not the illness I wanted. How the society will treat me, how my peers will look up to me. Then, as the disease progresses, or in consulting 2-3 years, or sometimes, then it comes down. So definitely stigma persists in the society, stigma persists in the family, stigma persists among the individuals related to mental health.
Sir, one more question. Are you finding that nowadays children have more stress because the demand on academics, then the peer pressure, etc., are really playing on their minds? Do you think that today the children are subjected to more stress and anxiety, and as a result they are getting into some kind of an emotional breakdown and all that? Do you see that in your practice, sir?
What we should know, a country like India, our wealth, what we can give to our children, give it to our children, is knowledge. It is only the knowledge which is going to earn their bread in this country, rather than any physical wealth which is not well distributed. So every parent would like to emphasize on education, reaching the best, and think that once they are in a professional course and got into a job, they feel the life is settled for them. So in that context, naturally there has to be a lot of pressure, especially more so in South Asian countries, including in a country like Japan, that's China, India. We can take these three developed and developing countries. That's why we can see highest suicide among children and students, adolescents, highest among this population, because our wealth is knowledge. When we consider in this country education and knowledge as wealth, there is always going to be a pressure on the children and adolescents. So when it happens, this is one aspect of it. Second is, today, because a lot of parents also want their children to perform well, when there is a drop in academics, usually some sensible parents would like to consult mental health professionals. That's why we are able to make more diagnosis of conditions like attention deficit, hyperkinetic disorder, some learning disabilities. The child can be very intelligent, average intelligence, nothing wrong in that, but the child may have difficulty in only mathematics, what we call specific learning disability in the sphere of maths. It can be in languages, so it can be in spelling, something like they can think but they may not be able to translate to writing, or the child may be very intelligent, prepared well, anxiety itself can kill the performance. So all these things we are able to see, because there is a huge stress on children in view of their expectation and societal changes, which is so rapid, we take some more time to get used to it.
So with the increase in stress in your daily lives related to job or relationships, marriage, etc., So, could you suggest some simple daily practices through which we can maintain a good mental health?
I would like to start from this. One, about the job related stress. There's a beautiful article I read yesterday. Till yesterday, an employee used to call the shot. I work with these conditions. If I am not satisfied, thank you very much. I'll put in my papers and walk into the next office. Today, it has turned, the table has turned on the other side. They want to retain the job. They want to perform well. They want to stop looking for the outside world. So there is a huge stress. A chooser has become want to be a retainer rather than be having the choice. So there is a huge pressure on that community. For example, I just give one small example. A fellow has come from North India, has started his career in a metros like Bangalore, Chennai, Hyderabad, Mumbai, Delhi, where that is where it's all concentrated in this country. For some reason, he has to take a house on rent, he has to maintain some vehicle to run around, put the children into a decent school. So most of them all run on loans, EMI they have to pay. The moment there is a loss of job, God, they can't pack up and go back to their villages, nor they can maintain the same standard. There's a huge stress on that community, especially between the age of 25 to 45. Number one. Number two, today marriages are not like in the past. Though I am off the records, would like to tell, while in England, went for a brief training, in one day while having a cup of tea, one white man wanted to tease a group of our Indians. He said, gentlemen, you people see a lady for 5 minutes or 15 minutes and you make up your mind to marry, and how do you live with her? After a lull, one of our senior colleagues was extremely humorous and intelligent. He politely said, I do understand, I do agree with you, but in this country, you people have 5 years courtship and live in relationship, and at the end of 5 months you divorce. I don't know how the judgment differs. Means the moral of the story, what I could make a judgment, because there used to be societal things, there should be so many things. Support system was there. So the marriages had it. So the institution marriage is rapidly changing. So that is also coming. Equality is fine, but the mother of most of our marital disharmonies we are seeing today is in the realm of communication, the way they communicate, the expectation, and the personality issues. And one good news is empowering our women. They also have good rights to talk and put forth their views. How do the other person accept is a challenge. The societal change need to happen. So in this context, there is a turmoil among children and adolescents, young adults, and the marital issues. Will you agree with me? So we need to learn to cope up with this. So what we call it as today, wellness. What are the 6 pillars of wellness? First and the foremost is nutrition. We need not teach an alien one have some strange things like you should have soya milk. How many Indians can have access to soya milk? How many of them can have almond milk? If you look into the newspapers and the nutritionists, what they write are all majority are alien, are not affordable to day to day. So we need to educate children and our society about our cooking styles, how to improve the nutrition among their own food habits, rather than bringing in alien things. And it should be cost effective, it should be affordable, and it should be easily cooked. So that is first thing. Second most important is exercise, exercise, and exercise. Just going to gym for 1 hour is not enough. The exercise has to be spread out. If I can do something in the morning and something. For example, I am a busy executive. I do yoga in the morning, 20 minutes, Surya Namaskar with other things, pranayama. Evening when I find time, I may go to gym, I can go for swimming, I can go, nothing is available. Brisk walking is enough. So exercise is very, very, very important in today's, because with the stress, our the other changes which can happen in the body, apart from medical can impact the psychological also. Third thing, with the invention of electricity, all of us lost 1 hour of our sleep. We are supposed to have 8 to 9 hours of sleep as an adult. 8.5 hours is fine. The electricity came, was half an hour to 1 hour sleep we lasted. But today, the invention and all the gadgets entering our bedroom has further ruined the sleep and the sleep-wake cycle. Going to bed at 1 a.m., 2 a.m., getting up at 10 o'clock. What is the nature says? When sun sets, go to bed. Sun rises, wake up. So that's the law of nature. Today we have forgotten that. So sleep is extremely important. One should make sure they have 7 to 8 hours of sleep, which is as important as a diet and exercise. Today, one thing which is killing population is loneliness. So we need to socially get connected, which is equally important for mental health. Say no to drugs, including smoking and cigarette. Lot of myths are there in the society. It's extremely disturbing to know today 58% of alcohol consumption is in South India, where the majority of population lives in North India. So smoking is the gateway for drug addiction. Say no to smoking, you have saved half of your life. In the meantime, everyone who drinks will not become an alcoholic. There are a small percentage of people can be vulnerable to get addicted. So say no to alcohol before the age of 18. Say no to smoking forever so that you are saved. That's my today's message.
So speaking of seeking help, although there's a positive trend nowadays that a lot of people are coming out talking about their battles concerning mental health, there are still those who feel very hesitant to talk about their battles, their struggles with mental health, primarily because of the stigma attached to it, still in some parts of our country. So what is a message that you would like to give, a message of hope and encouragement to these people?
For example, one of my classmates working in a well-known country, he said for a population of 33 lakhs, there are 72 psychiatrists in his hospital. This country cannot happen, but still there is accessible today. So in this context, early recognition, early intervention, better prognosis.
Yeah, so before we wrap up, sir, one last question. It is said that there is no health without mental health. So what is the one simple thought, affirmation or reminder you'd like our viewers to carry with them about prioritizing their mental health every day?
Mental health deterioration can lead to many physical disabilities also. People with psychological disorders are more vulnerable for non-communicable diseases like diabetes, hypertension, ischemic heart disease. The reason being their lifestyle changes, their exercise level comes down, their sleep gets disrupted, their eating habits change. So there is a direct impact of psychological disorders on wellness, physical wellness. And people already having a physical comorbidity among the Indian population, especially diabetes, hypertension, can worsen those conditions and the mortality will be very high. So the best is early recognition, seek help and address mental health as a priority that can prevent precipitating a lifestyle disease or worsening the lifestyle disease. Seek help. It can be any mental health professional. If you have a stigma to go to a psychiatrist, no problem. Today you have got a chatbot to have a consultation where the privacy is also there. When everything fails, you can walk into a hospital.
So thank you very much, Dr. Jagadish, for having enlightened us on the various aspects of mental health. I'm sure all of us would benefit as a society from the tips that you are able to provide us. Of course, man is a bundle of emotions, and then that is the reason why he is more prone to these upheavals in life. So help is always there.
True.
That's the ultimate truth. So whenever there's no need to feel helpless,
True.
There's always hope, and the earlier you approach, the better is the result.
True.